The CareVent ALS handheld resuscitator provides automatic and manual ventilation in a compact, lightweight device designed to fit into the palm of your hand, with the added feature of demand breathing for the spontaneously breathing patient. The manual override button and setting selector are located on the front of the resuscitator facing the operator. This ensures that both hands can remain on the mask to facilitate a positive mask-to-face seal. A single thumb action will allow the resuscitator setting selector to be adjusted or manual ventilations to be initiated. Notice that the angle of the gas input connection is angled to keep the supply hose close to the body, minimizing the risk of entanglement during extrication, patient movement, or resuscitation efforts. The mask can be rotated freely with the swivel and accommodate resuscitation from any position. This allows the rescuer to maintain a patent airway and facilitates resuscitation and rescue efforts. The settings selected can be seen through the magnifying viewing window. With the setting selector slider control in the off position, the gas supply can be turned on and the resuscitator placed into a ready state. Rotate the setting selector slider control into one of the 6 automatic ventilation positions, and the unit will begin automatic cycling at the rate and volume selected. Overinflation is prevented and airway blockage is indicated by the audible pressure relief system. Excess gas volume is vented to atmosphere. The manually activated automatic override button, manual button, will provide either manual ventilation to assist patients that are experiencing distressed breathing or to provide ventilations to a non-breathing patient. The flow rate is equivalent to the automatic setting selected. As you initiate manual ventilations, you will hear the release of gas as the button is initially depressed. This is a pre-alert indicator confirming that gas flow is being initiated manually. As the button is fully depressed, you will hear the distinct sound of the ventilation gas being delivered. If the patient begins breathing spontaneously, they will be able to demand breathe on the device. If the demanded flow rate exceeds 30 LPM and is continued for greater than 1 second, the auto shut-off circuit will stop the automatic cycling of the resuscitator and allow the patient to breathe on demand at his or her own rate and volume. The maximum flow rate delivered is 120 liters per minute. This feature is independent of the automatic setting chosen. Due to its technologically advanced design, the CareVent ALS handheld resuscitator will not stack automatic ventilations on a spontaneously breathing patient. The automatic cycling will restart if the patient either stops breathing completely or the flow rate drops below 30 LPM for greater than 4 seconds. This takes place without any intervention on the part of the operator. This typically will take approximately 6 seconds in total before automatic ventilation will begin again. If at any time the patient recommences spontaneous breathing, the automatic cycling will stop, allowing the patient to demand breathe. Please note that the tidal volumes and negative demand pressures generated by children may not be sufficient to initiate the auto shut-off circuit. In these circumstances, the CareVent ALS handheld resuscitator will provide a mandatory minute volume to the patient as selected, and in addition will allow the patient to demand breathe. The CareVent ALS resuscitator has only 3 pieces that need to be disassembled for cleaning: the universal face mask, patient valve swivel housing, and silicone diaphragm. The CareVent ALS handheld resuscitator has been developed to meet the challenges of resuscitation by providing manual and automatic ventilation and demand breathing. The CareVent ALS handheld resuscitator is simple to operate, lightweight, innovative, and is the smallest fully featured resuscitator of its kind. It eliminates the need to carry bulky, cumbersome, multiple pieces of equipment that are often ineffective. Its design efficiency supports single-person resuscitation and CPR efforts and can provide the patient with 100% oxygen on demand without wasting time switching to ineffective oxygen therapy face masks that require a constant flow of oxygen.
To comply with the latest resuscitation guidelines of a 30:2 compression ventilation ratio in the mask-ventilated patient, depressing the manual override button will inhibit the automatic cycling for 20 seconds. This allows for 30 chest compressions to be provided. Automatic cycling will recommence after 20 seconds and the next breath will be delivered. Depressing the manual button for the second breath will again inhibit the automatic cycling for further 20 seconds for the next set of compressions.